A very good morning to all. Welcome to the National Postgraduate Quiz Competition and Cultural Evening 2022. Before we commence, I would like to welcome our guests with a floral token. I request Dr. Prachi to welcome our Honorable Vice Chancellor, Sir, Lieutenant General Dr. Bipin Puri. I request Dr. Anvesha to welcome the Founder President of IES, Honorary Brigadier Dr. Anil Kohli, sir. I request Dr. Himi to welcome our Pro Vice Chancellor, Sir, Dr. Vineet Sharma. I request Dr. Supriya to welcome President IES, Dr. Vivek Hegde, sir. I again request Dr. Prachi to welcome the Dean Dental, Faculty of Dental Sciences, Dr. R.K. Singh, sir. I request Dr. Anvesha to welcome UP Dental Council President, Dr. Pavitra Rastogi, sir. Let me begin this memorable day by wishing everyone a very happy Endo Awareness Day, celebrated on the 5th of March every year. As an expression of gratitude and celebration towards our specialty, we, the Department of Conservative Dentistry and Endodontics, King George's Medical University, organizes a very special inter-college quiz competition every year under the aegis of Indian Endodontic Society. IES is a non-profit organization which has been an active scientific body devoted to maintain the level of clinical and academic excellence in the field of endodontics throughout the nation. The quiz, which is held in a hybrid online-offline mode, has around 30 teams participating this year from various dental institutions all around the country. Along with the quiz competition, our department also organizes a unique student exchange program under the patronage of IES. The department has organized 2 such exchange programs earlier in 2017 and 18. Owing to COVID, the program got halted for the last 2 years, but this year we have successfully culminated the IES Student Exchange Program 2022, held at our department from the 28th of February to the 4th of March, where 23 students from 8 colleges across India participated in this academic extravaganza. In the coming years, we also look forward to host students from the neighboring countries like Bhutan, Nepal, Sri Lanka, and other South Asian countries. To proceed forward, I now would like to invite our dignitaries to officially inaugurate today's program by lighting the lamp.
कुन्देन्दु तुषारहार धवला या शुभ्रवस्त्रामृता या वीणावरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्माच्युतं शङ्करं प्रभृतिभिः देवैः सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा
Asan Vihan, he's good at studies. But one thing that he always struggled with was speaking fluently in English. At home, we mostly talk in our mother tongue.
And so he wasn't very confident in expressing.
Thank you, dignitaries. It is really an honor for us to be amongst the stalwarts of the field today, bringing together their wisdom and insights. I now would like to acquaint everyone with the leading person behind this special event, although requires no introduction, but he is a person known for his unending enthusiasm, a dynamic persona, and an exemplary leadership, Professor A.P. Tikku, sir. Dr. A.P. Tikku sir is...
Thank you, Soumya. Good morning to all of you, the dignitaries on the dais, our Honorable Vice Chancellor Sahab, Lieutenant General Bipin Puri ji. Sir, you know, I've been here in this university for almost all my life, in 44 years. And for the first time, we have our Vice Chancellor who's from the armed forces. And we have seen the difference he has created after he has joined. Sir is the recipient of the Vishish Seva Medal and the Param Vishish Seva Medal. A big round of applause, boys and girls. Lieutenant General Puri Sahab, before he came here, was the Director General of the Armed Forces Medical Services. So you see the vast experience of administration he has been seeing over his career. Being the chief of the Armed Forces Medical Services, you understand, it means the chief of all the three forces, the Army, Navy, and the Air Force. So he was heading all the armed forces, and after that, after retirement, he has joined us. Thank you, sir, for your able administration and your guidance. Sir is also a very strict disciplinarian, as we all know, but he is a person who is very kind and generous and compassionate at heart. Thank you, sir, for your able guidance and for your presence here. We have with us Dr. Anil Kohli Sahab. He is like a family to me, like elder brother to me, my mentor and my guide all my life, the ex-president of the Dental Council of India, and also Padam Shri, Padam Bhushan, B.C. Roy Awardee, and also he holds the rank of the Honorary Brigadier of the Indian Army, the same rank which Kapil Dev also holds. So you can see his status. Thank you. He has just arrived from Delhi, and he is always, his blessings and his guidance is always with he's the founder member of the Indian Endodontics Society. He was the president, and his guidance is always there for the Indian Endodontics Society. With us is our Honorable Pro Vice Chancellor, Professor Vineet Sharma Sahab, the Professor and Head of Orthopedics, which we all know has been helping us and guiding us in all our endeavors. And this postgraduate program is also under the guidance of our Honorable Vice Chancellor and the Pro Vice Chancellor, and their enthusiasm has been shown by the university administration so that we can hold this program every year. A big round of applause to our Honorable Pro Vice Chancellor. We have with us the President of the Indian Endodontics Society, the current sitting President of the Indian Endodontics Society, Professor Vivek Hegde. He has come all the way from Pune to be here with us. And a round of applause for him. He has a lot of accolades and to his resume. And he is the Professor and Head at Rangoonwala Dental College in Pune. He's a very dear friend of ours. And his presence here, it gives a boost to the Indian Endodontics Society and the functions of the Indian Endodontics Society. We welcome with us our Dean and my class fellow for the last 44 years, Dr. R.K. Singh. Professor R.K. Singh is our Dean. And also, you know, we have, he's a very approachable Dean, as we all know. Anybody can go and speak to him anytime and ask him for anything, and he's always ready to help you out, all the students. So big round of applause to our Dean also. We have with us Dr. Pavitra Rastogi, who is the Professor in Periodontics and is also the President of the State Dental Council. So a very, very dignified person and a very important post. And thank you. Pavitra is also my student. He is our student from BDS first year. And we are very proud to see our students doing so well and holding very important posts in life. This, sir, I will tell you this program. This is the second time we are holding this All India Interquiz program. It is a unique academic extravaganza. It has never been held in the country before by any institution. It is the King George's Medical University which holds this function, and this is the second time we are holding it. And we want to make it a tradition, sir, to hold it every year. We had lesser teams last year, but this time we have 31 teams. And next year we also plan to include the students and the colleges of the SAARC countries, the Bhutan, Bangladesh, Sri Lanka, and Maldives and other SAARC countries if possible. So we will expand the exchange program. In the exchange program, we have students who are very eager to come to King George's, to the dental faculty, because they have all heard about the King George's Medical University, the aura and the traditions and the cultures and the academics of King George's. So they all are very keen, and they are, I'm sure, very happy. And we had a very good interaction with 23 students from various parts of the country who have come and interacted with us. We have had good interactive sessions with them. We have interdisciplinary sessions with them. Dr. Pradeep Tandon from Orthodontics and Dr. Anjani Pathak from Perio, Dr. Richa from Pedo, and like this. So we have Dr. U.S. Pal from Oral Surgery. So we have interdisciplinary lectures for them also, sir. So this is what we have. And now we will have the quiz program. And I'm sure the BDS final year and the intern students here, this is a very unique opportunity for you to be a part of this extravaganza, the academic extravaganza. This will help you because this is an MCQ program. It is on-site teams and online teams. So you will be able to grasp what is happening. We have been able to hold this function thanks to the excellent teamwork of our department, which includes all the faculty members, especially Dr. Ridham, Dr. Pramla, Dr. Rakesh Yadav, and all the others, Dr. Ramesh Bharti, Dr. Vijay Shakya, Dr. Pragya Pandey, everybody, and all our residents. It's a very, very close-knit unit in the department, sir. They are very sincere and they're working selflessly. And that is why we are able to arrange this program. It is not easy to arrange such programs, I can tell you. I am only a guiding factor behind them and a guiding force behind them. Most of the work and the active work is being done by them only. And thank you, all of you, for doing whatever you have done. And they have interacted excellently with the visiting postgraduates, sir. They are looking after their residence, their accommodation, their water program, everything they are, any problem or any help they're needing, our residents are always willing to give them. We welcome also amongst us all the heads of the other private institutions of the Department of Conservative Dentistry. Dr. Sanjeev Srivastava is here from Sardar Patel. Dr. Verma is here from the college. Anybody here from Korea? Chandra, anybody here from Korea? Okay. Dr. Pradyumna Mishra has not come. And we have any other person is from other colleges here. We have our big round of applause to our Dean Student Welfare. Dr. Srivastava Saab is here. Our head of oral surgery, Dr. Shadab Mohammed, Dr. Pradeep Tandon. And I'm also thankful to my wife, Dr. Tripti Tikku, to be here in the morning on a holiday. So thank you. See, in this quiz program, we don't participate as host teams. I can tell you this, sir. We don't participate as host teams because of a simple reason. They asked me whether we should also participate. And I'm sure they can win also. They are very brilliant students here also. But मैं तो इनसे कहता हूँ कि देखो अगर जीत जाओगे तो सब कहेंगे इनको क्वेश्चंस पता थे इसलिए जीत गए. अगर हार जाओगे तो लोग कहेंगे इनको क्वेश्चन पता था फिर भी हार गए. So it's a no-win situation. So we tell them not to participate and be hosts only. Thank you everybody for your presence here. And thank you, sir. Thank you, sir.
Thank you so much, sir. It's an honor to have with us today our Honorable Vice Chancellor, Lieutenant General Dr. Vipin Puri, sir, who is, in spite of his busy schedule, has graciously agreed to be present on this occasion. Sir, we request you to kindly encourage us with your august words.
Professor A.P. Tiku, Head Department of Conservative Dentistry and Endodontics, Honorary Brigadier Professor Anil Kohli, ex-President DCI and Founder President of the Indian Endodontic Society, Professor Vivek Hegde, who was the President of the Indian Endodontic Society, Dean Dental Sciences, KGMU, Professor R.K. Singh, Professor Pavitra Rastogi, who is the President of the DCI Uttar Pradesh chapter, distinguished faculty members, heads of departments, various colleges, our own medical and dental university, faculty from the dental sciences, in endodontics in particular, residents, delegates from various dental colleges, ladies and gentlemen. At the outset, let me begin by conveying my compliments on behalf of the university to the Department of Conservative Dentistry and Endodontics. I think it's a very exciting phase in this journey of learning that we keep doing from time to time, these exchange programs. And this, of course, is the culmination of a 1 week long exchange program, and also culminating on the Endo Awareness Day, which was news to me. It's 5th of March, the Endo Awareness Day. I think it's a very beautifully timed event, 1 week of exchange program where you talk about academics, look at sensitivities of bring in cutting edge technology, take back ideas, ideations, thoughts, challenges, and try and take this forward to your own college. Imbibe new things from the environment and take it forward. So I think it's absolutely brilliant to see this program going through 23 students, I'm told, 8 colleges from all over the place, UP, Haryana, Himachal, Maharashtra, Madhya Pradesh and Tamil Nadu are participating in this exchange program. So very good, excellent. Congratulations to the department. And I was very pleased to see the academic events as well, be it clinical demonstrations and presentations on various issues, rotary endodontics, direct filling gold. Gold, I was told, this is the only institution which does gold fillings. And lasers and endodontic microsurgery, research methodologies, etc., etc. So I think it's a huge amount of learning. And learning is not only by didactic lectures. Learning today has changed. Learning is on hands-on, when you interact, when you discuss, when you talk about your issues and problems. It's only when you solve these issues in a hands-down program do you actually learn. And when you take new ideas from new institutions, from different teachers, I think that is collective learning. And I think towards that extent, I congratulate the Department of Endodontics for taking this forward. I'm told that it wasn't only academics, it was also a little bit of fun activity thrown in, and the group of 23 were taken all over Lucknow, and they visited a couple of sightseeing places as well. So I'm very happy and very pleased for that the department and the college has looked after them. Well, friends, boys and girls, ladies and gentlemen, quizzing. Quizzing is today an evolving science and art by which theory is taught to you by its applications. It's not just telling you, asking you 2 plus 2. It is asking you the various methodologies, what could be the permutations and combinations. So it's looking at what could be the horizontal and vertical alignments, the applications. It is these platforms, these these quizzing platforms, which are actually tutoring your minds. And there are 2 things, remember, in quizzing which are of importance. One is accuracy, so you must know the right answer. And 2 is speed. Accuracy and speed. These 2 are the fundamentals of any quizzing competition. And let me tell you, friends, boys and girls, this is the crux today. In a very, very competitive world, this is what is being expected out of you. Accuracy and speed. Can you do it? Can you perform? I'm very happy to see that this is being very actively being participated by 31 institutions of the country and on a hybrid mode. And very, very pleased to see that there are 14 teams are here on site and the 17 are connecting with us on the online platform. So I think congratulate once again Professor Tiku and his very dynamic team. Very, very pleased for taking this forward. I wish them all success and may the best team win. Thank you, ladies and gentlemen.
Thank you, sir, for gracing us with your time today. I request Dr. Pramila ma'am to kindly present a memento to Honorable Vice Chancellor, sir. I now would like to invite our Dean, Dr. R.K. Singh, sir, who is the fountainhead of inspiration for all the dental departments. Sir, kindly grace us with your blessings.
Good morning, everyone. Being a Dean Faculty of Dental Sciences, I thank you all for participating in this Postgraduate Student Exchange Program, which was organized by Department of Endodontics, of Conservative Dentistry and Endodontics under the dynamic leadership of Professor Asim Tikku. It's a matter of... It's a matter of great privilege and honor for me to extend my hearty welcome to our dynamic Vice Chancellor, Lieutenant General Puri sir, although he is not here, Pro VC sir, Brigadier Dr. Anil Kohli, former President, Dental Council of India, Dr. Vivek Hegde, President, IAS, and Dr. Pavitra Rastogi, President, UP Council, dignitaries of the dais, faculty members, and dear students. The program has aimed to motivate and cherish young minds through their understanding of array of different cultural and community perspectives and understand and creating awareness and adaptation of alternative approaches to learning and to develop analytical problem solving skill. I also take opportunity to thank our guest speaker and the other speakers of this university who have made this program more meaningful by participating, sharing their expertise, experience in this interdepartmental interactive program during the 6-day session. I am confident that this hectic program and interactive program has already enriched your knowledge and cleared your all misconception or confusion about the operating procedure, different operating procedures. I hope as you leave for home, you will be carrying along with your enriched knowledge embedded with the sweet memories of this historical city. Thank you very much for being with us and coming from all over the part of the country and make this program more successful. Thank you very much.
Thank you so much, sir. We look forward to the decorous present of Dr. Vivek Hegde, President of the Indian Endodontics Society. Dr. Hegde is Professor and Head in the Department of Conservative Dentistry and Endodontics at M.A. Rangoonwala Dental College, Pune. I welcome you, sir, to kindly brief us.
Thank you. Good morning, everybody. Respected dignitaries on the dais, esteemed chief guest, Dr. Pipin Puri, sir, he had to leave for his important commitment. Pro Vice Chancellor, sir, Dr. Vinit Sharma, sir, Founder President, Indian Endodontics Society, Brigadier, Padma Bhushan, Padma Shri, Dr. Anil Kori, sir, Dean, Dr. R.K. Singh, sir, Professor and Head of the Department, Dr. Tikku, sir, and UP Dental State President, DCI, Dr. Pavitra Rastogi, sir. To also dignitaries of the dais, various head of the departments, and dear friends. It's a nostalgic feeling because when I took over as the president last year, it was around this time, when it was first program of our team held here. And Dr. Tikku sir had invited me even that time. So this same room, the entire aura, the ambience still remains the same. The whole working team, I can see Tikku sir and the entire team really work hard, and they put up a good show last year. I saw the pictures and the glimpses which was playing earlier. So congratulations to the entire team who've done a good job. And this concept of bringing all the colleges together is a nice concept. In fact, we were speaking with Tikku sir and Kohli sir that IES would want to expand this in different parts of the country. So the same thing we want to replicate in the south of the country, east and west also, as an exchange program for a week. IES has been in the forefront of a lot of activities. We have done plenty of online activities because of COVID, but we are also going into hybrid mode, and now we are mostly on-site activities. We ended up a very good show. This reminds me of like KGMU or KGMC Conservative Dentistry Department has always been in the forefront and has done a lot of activities in style, I'd say. It reminded me of the Endodontics, sir. When we did the IES IFIA World Congress in Chennai, we started the flag when Kohli sir in Delhi opened up the torch, and it went to different states. So I remember Kohli sir giving me this compliment, telling that I think Dr. Tikku sir has done it very well and in style. That's exactly how KGMC has done it. In fact, of all the states, I must say, sir, that your torch that carried from Lucknow was one of the best. Yeah, thank you. So that Congress was very good. In fact, it was the World Congress. Because of COVID, we had in 2 editions. We had more than 7,000 people all over the world with 40 countries and plus participating, with about 7,000 members and 55 speakers and about 35 participating companies. So a good exchange of program. We made new friends, we made good commitments, and we have good collaborations now. A lot of new collaborations with different countries have happened. So IES is looking at that. So my term ends next week with the last program of ours, I think, happening in Pune. And I know most of you are participating in that event. I welcome all of you to come there. There will be a national update for 2 days with a lot of PG papers. 187 PG papers and posters are there in at Rangunwala Dental College, Pune. And on the next day, we'll have a conference with 7 world-renowned speakers of different topics. So this is what IES could do. We are a good member of 3,500 people now, and we are here to grow and urge the young minds, the budding faces, that we are a progressive thinkers and we want to go ahead in a long way. I want all of you to join us and take this forward. With these few words, I'd like to thank Tikku sir and the entire team for inviting me here. Thank you so much.
Thank you so much, sir. I am profusely glad to invite Padma Bhushan, Padma Shri and BC Roy awardee Dr. Anil Kohli sir with us today. Dr. Kohli has been the founder president of IES and is one of the eminent private practitioners in New Delhi currently. I would like to invite sir. He was also the former president of the Dental Council of India. I would like to invite sir to share his thoughts of wisdom.
Thank you. A very good morning to all of you. The Pro Vice Chancellor, the Dean of the Dental Faculty, Asim, Vivek, Pradeep Tandon, Shadab, and other friends in the audience, and the boys and girls. I'm not going to make any speech here. Firstly, I'm the last one to speak here, so I have to see how much I can speak. Nobody can stop me. And 10:45, you have to go for the tea, and 11, you have to start the function. So for me, coming here is like coming home. So I don't like to make any big speech and promises and all that. I share the experiences, what I had. Where you are sitting, I used to sit here and watch the proceedings and watch the way functions are being done, honors are being given, and always look that someday I will also receive one honor. And I did receive, that was in 1976. So you walk through the stairs and you reach to the dais and all that. It's a wonderful feeling, it's very nostalgic and all that. Now you people are dealing in endodontics. As everybody said, it's a very vibrant society, it's very vibrant this. You deal with a very vibrant part of the tooth. So you have to be vibrant like that, and which Asim is. But let me tell you, future belongs to you. You are the future of dentistry. You are the future of nation. You are future of the profession. Because everything ends up and everyone has to give up at some point of time. As Vivek said, next week he'll be leaving 1 year. And what he has done in 1 year, I didn't see in my professional career anybody has done. Coming to Asim, so he's great, no doubt about that. But sometime he goes off the track. So he's a wonderful friend, wonderful organizer, and a wonderful golfer. I don't know how many of you know, he's a big time golfer, and he had a very good price tag now in Lucknow, which is very proud feeling for field of dentistry. Not only he excels in profession, he excels in cricket, he excels in golf, and anything you name in life. So he has very good family. Thanks to Dept, how he handles, I don't know.
I've taught Dr. Kohli golf. I'm the person to teach him golf.
Yeah, he's my mentor in golf. Otherwise, I am his mentor. So, this is firstly, this is the thing which they have started, like exchange program of the faculty and other thing, which was very, very good thing, because people don't know about King George's. Because I am born here in the Queen Mary. So I know everything. The person born here, person is studied here, and whatever I am today, it belongs to this institution and my teacher, Dr. Chawla. So I cannot forget and can't give back enough to this institution, what it has given to me. And let me tell you one thing very interesting. People might think that dentistry is a small field, in dentistry you cannot reach. But I can tell you, what as a dentist I have achieved, if I was a medical person with Naresh Sen, I couldn't have achieved what I have achieved as a dentist. So all of you are capable of reaching to that height and achieve. But there has to be a passion. You need a liking. It's not like that कि घर वालों ने कहा कि जाओ dentist बन जाओ तो बन गए. वो नहीं. You have to have the passion for the profession, and you should be achiever always. Everyone can achieve. You cannot say कि like X has become, Y has become. So there has to be a zeal to reach to that thing, and all of you can. And you are lucky to be in this profession and doing like so good, and you have a good opportunity, good environment, good number of patients. If you look at a private college, like for 100 students, they don't have 100 patients. Forget about faculty and all. Here you have thousands. So what opportunity you have been given. But it is up to you to how you avail, how you achieve. You have to see. Because it's a great institution, it's a great country. And they are great people, and you are also great. And I want each one of you to achieve something in life so that you should be proud. Okay, where you are sitting next time may not be in my lifetime, but someday you should also be sitting on the other side of the crowd. And that makes you happy, to you, your family, and other people. And that should be the target for all of us, to make our children to reach to that stage. Because for Asim also, if somebody comes and sits next to him, that is the biggest gift one can give it back to the teacher. Look at Pradeep Tandon. So he has taught so many orthodontists and made Shadab. All these people are achiever. And we are really proud and to belong to this institution, and it's lovely to see nice people sitting in the crowd, especially girls, boys. It makes you feel so proud. And I wish you all the best, good luck, good family, and good professional. Thank you very much.
Thank you, sir. I also invite our Pro Vice Chancellor, Sir, Dr. Vineet Sharma, Professor, Department of the Orthopedic Surgery, to bless the gathering with his wisdom thoughts.
Thank you. Brigadier Anil Kohli ji, Dr. Vivek Hegde, Dean Dental Sciences, Dr. Pavitra Rastogi, my dear friend Tikku, Dr. Sadab, Dr. Pradeep Tandon, Dean Students Welfare, R.N. Srivastav, respective heads from different colleges, our heads, Faculty of Dental Sciences, students, ladies and gentlemen. It's a real pleasure to be here today, and especially the quiz that has been organized by the able team of Professor Tikku and his team. Quiz basically helps you to compete, number one. Number two, face the challenges in life. Nobody is a loser, nobody is a winner. Everybody is a winner. And as Professor Tikku said, the team from KGMC is not participating because of two reasons, as I've already told you. Apart from academics, of course, extracurricular activities also play an important role, and I think that has also been given a very special place today. I congratulate you, I wish you all the best, and my best wishes. Thank you.
Thank you so much, sir. Moving ahead, we now would like to present mementos to our respected dignitaries as an expression of gratitude. I request Dr. Rakesh Yadav, sir, to present a memento to Honorary Brigadier Dr. Anil Kohli, sir, Founder President of the Indian Endodontics Society. I request Dr. Ramesh Bharti, sir, to present a memento to Dr. Vivek Hegde, sir, President, IES. I request Dr. Pragya Pandey, ma'am, to present a memento to our Pro Vice Chancellor, sir, Dr. Vineet Sharma. I request Dr. Nishi Singh, ma'am, to present a memento to Professor R.K. Singh, sir, Dean, Faculty of Dental Sciences, KGMU. I request Dr. Vijay Shakya, sir, to present a memento to Dr. Pavitra Rastogi, sir, President, UPDCI. I kindly request Dr. Rhythm, ma'am, from the Organizing Committee, Department of Conservative Dentistry and Endodontics, KGMU, to extend the vote of thanks.
A very good morning to all. I am deeply humbled to extend a vote of thanks for the occasion of the second edition of the All India IES Postgraduate Quiz competition we are organizing today. And first and foremost, though VC sir left, I extend my heartfelt gratitude to our Honorable Vice Chancellor, sir. He has always been a motivating factor. He is a visionary, disciplinarian, and he has changed the way and outlook of the university work. My deep gratitude to Honorary Brigadier Dr. Anil Kohli, sir, Padma Shri, Padma Bhushan, for being here again today, sir, taking out time from his so busy schedule and being with us, traveling all the way from Delhi and motivating us and encouraging us and having the faith in us that we can do better in the coming years also. My heartfelt thank you to Dr. Vivek Hegde, President, Indian Endodontic Society, a dynamic and a young leader, and like Dr. Anil Kohli just mentioned, he has achieved a lot throughout the year of his presidentship, and we can say that he started his presidentship on the note of this quiz competition, and again towards the end of his tenure, he's again with us here today. Thank you so much, sir. I thank our Pro Vice Chancellor, Dr. Vineet Sharma, for being with us here today and gracing the dais and motivating and encouraging us. I extend my gratitude to Professor R.K. Singh, sir, Dean, Faculty of Dental Sciences. He has always been a support. He's very pro-student, and he has always worked and very hard to make things possible for the organizing committee and for the students also who can benefit from this exchange program and from this quiz competition. I thank you, Dr. Pavitra Rastogi, sir, President, UP State Dental Council of India, for being here with us today and gracing the dais. Any and every event is a teamwork, and most of the teamwork depends upon the leader of the team. I thank our dynamic, like Anil Kohli sir said, vibrant team leader, Professor A.P. Tikku sir, our head of the department, and a guiding force, we can say, a support, a mentor. At every step of this event, he has guided us. And we are new, we are not experienced. He has always shared his experiences with us and guided us on every step that how to go about all the intricacies of the event. Thank you so much, sir, for always being there. And like I said, the team, the main role of the excellent team of Cons and Endo we have here today, and many sleepless nights and a lot of hard work has gone behind this quiz competition. Behind every event, there is a lot of hard work. What appears on the stage, the things which are happening backstage, they matter a lot. So our excellent team, Cons and Endo, Dr. Pramila Verma, Dr. Rakesh Yadav, Dr. Ramesh Bharti, Dr. Vijay, Dr. Pragya, Dr. Nishi Singh, all my senior residents, my junior residents, the support staff of the department, and the undergraduate students who are present here today, all are behind whatever you are seeing in this hall today. Thank you so much. A very, very special thanks to the IT cell of KGMU, Dr. Richa Khanna in charge IT cell, Mr. Farhan and Mr. Vinayak who are here, and they have only made this the physical shape of this idea we had of organizing a hybrid online-offline event. And thank you so much, IT Cell, for your relentless support. I thank all the heads of the departments of KGMU and of the other universities, all senior faculty members of KGMU and other universities who are here with us today. And your coming here today shows that you have faith in us, you believe in us, and you are there to support us. Thank you so much. And last but not the least, the most important part of this event, the participants. Since the last 1 week, we have here with us 23 students from 8 colleges across the India, and they are here with us. They have learnt with us, they have had fun with us, they have shared their experiences with us, and it had been a very pleasurable time to have you with us, and I'm sure you will take back some good memories and a lot of learning experience to your institutes when you go back. And thank you all the participants of the online and the offline quiz participants who are taking part in this event and making this possible. Like sir said just now, that winning and losing is not the thing. The important part is participation. So I thank you all, and I wish you all very good luck, and I wish you all a very happy participation. And I hope that all of us will go back to our colleges, our institutes, our places from where you all have come with some good memories. And it was been a very, very, very pleasurable time having you all with us in the exchange program. Thank you so much. And I'm sorry if I have missed anyone. Thank you.
Thank you everyone for being a part of this wonderful morning. We will continue with the quiz competition after the inaugural tea break. I request all the dignitaries, all the senior faculties and guests to join for the tea in the boardroom and all the participating teams in the adjoining hall. Thank you. All the students in the adjoining hall.
ये लोग सब ऑफलाइन है.
मैम सब लोग अपना अपना स्पीकर बंद कर दीजिए, म्यूट कर दीजिए. जिससे बोलना उससे बोलेंगे, इससे बोलना चली जाएगी. तो हमारे यहाँ पे दिख रहे हैं कुछ ये बाहर वाले भी आ रहे हैं. प्लीज ऑल ऑफ यू टर्न ऑन योर स्पीकर्स, म्यूट कर दीजिए स्पीकर्स. विनायक जी इसकी ना आवाज शायद ऊपर जाने पर एग्जाम वॉल्यूम कम कर दीजिए. Have all the online participants joined? Online participants, can you hear me? Army Dental Center, RNR?
Yes, ma'am, we can hear you, ma'am.
Yes, ma'am, we can.
Yes, ma'am, we can hear you.
Hospital? Yes, ma'am, we can hear you.
Institute of Dental Sciences? Municipal Dental College?
Yes, ma'am, you're audible.
Savita Dental College, Chennai?
We can hear you, ma'am.
Panania, Hyderabad?
Or the voice company.
BS Dental College and Hospital?
BS Dental Bangalore है. City का नाम नहीं लिखा. We can hear you, ma'am. From BS Dental.
Krishna Dev Rai College of Dental Sciences and Hospital? Banaras Hindu University?
Yes, ma'am, you are audible.
Sri Ganganagar? Manipal College of Dental Sciences?
Audible, ma'am.
Saraswati Dental College?
Audible, ma'am.
Faculty of Dental Sciences, Ramaiah University? ITS Muradnagar? Seema Dental College, Rishikesh? ITS Bareilly?
Yes, ma'am, you're audible, ma'am.
AIMS New Delhi?
You're audible. Yes.
Career Dental College, Lucknow?
Yes, ma'am, audible.
Voice is not clear.
तभी आपसे बोला था कि नेचुरल वाला इसमें जो कर्सर कहाँ चला जाता है बीच बीच में
मैं उसके वीडियो पे लाइक मैंने अभी यूट्यूब पे इसको दोबारा से खोला नहीं सुना था 2 मिनट देखिए सबका कैमरा माइक सब बंद करा था
सर ज्योति ज्योति सर मनीषा और सर एक दो लोगों का कनेक्ट नहीं हुआ है हाँ सर 26 people and तुम्हारा मोबाइल से चल गया
For the online participants, only 2 participants should be there on a single device, and no other person should be there in the room. If any eye movement or any body language we find doubtful, we'll point it out and it will be excluded. And the time for answering the questions is 10 seconds. The questions will not be passed. You will be asked a set of 3 questions in the first round. Each team will be asked a set of 3 questions, and we will be eliminating a few teams in every round.
should we start
Have all of you now connected and joined the meet? All of you?
Ma'am, please more loud.
We will start asking questions from the offline participants, and as we complete the set of questions from the offline participants, we will move on to the online participants.
शुरू नहीं हुआ श्रेया अभी तक नहीं आया
And when you will answer the question, like suppose your answer is C and something is the answer, you will call out C and answer. Don't just tell the answer, also tell the option name, like A, B or C or D, okay? Then for scorers to score if you tell it, call it out clearly. Now scoring team, Dr. Soumya, Dr. Jyotsna, Niharika, all ready? There is no negative marking. The questions will not be passed on. But you will be some teams will be eliminated after each round because nahi to pura din we will have the quiz only.
तो यही नाली
I hope everybody has joined through the college email, so that we can easily identify the teams. So, Vinayak ji, is it all set? Can we start?
माइक कैसे दें? एक ही लाइन
तो एक है हमारे पास और एक दो पीछे कर दीजिए एक आगे
വന്നോ തുടങ്ങി തുടങ്ങി നീ സമയം എടുത്ത് വേണമെങ്കിൽ
दिव्या
വർക്ക് എവിടെ ഉണ്ട്
तुम माइक दे दो कि जब कोई
വന്നോ വന്നോ
ये रुक किसी अरे जाके थी you will have to hand over the mic
इधर ले मैं बात कर ये हर राउंड के बाद हर राउंड
So I think we are all set. So without further delay, we will start the quiz competition. All the best to you all. Okay? Like sir said, no winners, no losers. We are all winners. So we'll start the quiz on this note.
विनायक जी फरहान एक मिनट की स्क्रीन शेयर करो Guys, laughing too much, nahi? AMCD.
ये भी किसी में जब तक आप शेयर नहीं करेंगे तब तक नहीं दिखेगा आप उसको है
वो दिख जाएगा फिर हमारा
वो तो स्क्रीन आपकी ड्यूटी नहीं दिखेगी तो स्क्रीन आपकी
शेयर करें स्क्रीन शेयर करें
ये करो
राइट शो
आएगा वो उधर अभी मैं कर दे रहा हूँ
So my first set of questions will be from Maharana Pratap College of Dentistry and Research Center, Gwalior. Dr. Mansi and Dr. Diksha Yadav. So your question is? So the first question is, during endodontic treatment, the outer wall of the optical curvature of the canal with inflexible instrument will cause option A zipping, Option B, perforation. Option C, elbow formation. Option D, ledge formation.
It's C, elbow formation.
Sorry, the correct answer is zipping. The second question from Harana Pratap. An 8-year-old boy presents with an Ellis class 3 fracture of right maxillary central incisor which happened an hour ago. The apex is not yet closed. Your first treatment should be direct pulp capping with calcium hydroxide, pulpectomy followed by root canal treatment, civex pulpotomy, or smoothing the edges and restore with composite. Sorry? The correct answer is smoothing of the edges and restoration with composite. The third question will be a GK question. 2 questions will be ND and 1 will be GK. So the third question from Harana Pratap. Who is the author of famous comics Chacha Chaudhary? R.K. Lakshman, Yeshu Dasan, Pran, or Sudhir Dar?
R.K. Lakshman. R.K. Lakshman.
I'm sorry, the correct answer is C, Pran, a very famous cartoonist of India. Don't lose heart. Now we move on to the next team, Subharti Dental College, Meerut. The first question for Subharti Dental College, Meerut attempts to increase success of the inferior alveolar nerve block are all except increasing the volume of anesthetic, addition of hyaluronidase, decreasing epinephrine concentration, or carbonated anesthetic solutions.
Ma'am, C, decreasing epinephrine concentration.
Yes, this is the correct answer, decreasing epinephrine concentration. Next question for Subharti. Efficacy of irrigation is affected by all except depth of needle penetration, coronal pre-enlargement, temperature of irrigant, or the remaining radicular thickness.
Remaining radicular dentin thickness. D.
This is the correct answer, Subharti. Well done. The third question for Subharti. Which historical character does the Statue of Equality depict? Swami Vivekananda, Rabindranath Tagore, option C, Agatya Muni, or option D, Rishi Ramanujacharya?
Swami Vivekananda.
The correct answer is Rishi Ramanujacharya. It is a recently installed statue. Next question for Sardar Patel Dental College, Lucknow. Which of the following is not a hemostatic drug used during endodontic surgery? Surgicel, gel foam, calcium sulfate, or calcium carbonate?
D, calcium carbonate.
This is the correct answer, calcium carbonate. Second question for Sardar Patel. When perforation occurs, the first step is to locate all the canals. Locate all canals and insert files into all the canals. Control the hemorrhage or place calcium hydroxide paste.
C, control the hemorrhage.
Well done, Sardar Patel. Your answer is correct. Next question for Sardar Patel. Who is known as the father of India's first nuclear program? Homi Jahangir Bhabha, Vikram Sarabhai, C.V. Raman, or APJ Abul Kalam Azad?
A, Homi Jahangir Bhabha.
Correct answer, Sardar Patel. Very well done. Next question from Rishi Raj College of Dental Sciences, Bhopal. Slog method of X-ray imaging is useful in the diagnosis of pulp stones, lateral canals, internal resorption defects, or hyperemic pulp.
C, internal resorption defects.
Yes, this is the correct answer. Next question. The cervical cross-section of pulp cavity below represents which tooth? permanent maxillary right first premolar, permanent mandibular right first premolar, permanent mandibular second premolar, or the permanent maxillary right canine?
C. Permanent mandibular second premolar.
The correct answer is permanent maxillary right first premolar. Your third question, Rishiraj. For seeing objects at the surface of water from a submarine underwater, the instrument used is periscope, telescope, kaleidoscope, or spectroscope.
A. Periscope.
Well done, it is the correct answer. Next set of questions from Chandra Dental College. Which of the following is an indirect digital imaging method? Radiovisuography, charge coupled device sensor, zero radiography, or phosphor coated plates?
Charge coupled
Your
device
time
sensor.
is over. The answer was phosphor coated plates. Next question from Chandra Dental College. All of the following cause internal discoloration of teeth except porphyria, erythroblastosis fetalis, tetracyclines, or diabetes mellitus?
Diabetes mellitus.
Correct answer. Next question from Chandra Dental College. The depletion in the ozone layer is caused by carbon dioxide, nitrous oxide, methane, or chlorofluorocarbon?
Chlorofluorocarbon.
Correct answer, Chandra Dental College. Now we move on to DAB Dental College, Yamuna Nagar. The clinical features of which of the following conditions may be described as stones, bones, groans, and moans? Hyperparathyroidism, hypophosphatasia, Paget's disease, or hyperthyroidism?
Hyperparathyroidism. A.
Okay, we'll give it to you. It was just on the nick of time. Hyperparathyroidism is the correct answer. Next question, DAV Dental College. A patency file is used to deliberately enlarge the foramen, helps to eliminate apical blockage, should be used vigorously, or is rigid in nature?
A. Is used to deliberately enlarge the foramen.
The correct answer is helps to eliminate apical blockage. Third question, DAV Dental College. Indian Standard Time is based on what longitude? 80.5, 81.5, 82.5, or 84.5?
C.
Correct answer. It passes through nearby Allahabad. Next set of questions from BBD Cords, Lucknow. BBD Cords, raise your hands. Isko do mic. Mic also. What term denotes endodontic failure? Primary apical periodontitis, post-treatment apical periodontitis, secondary apical periodontitis, or none of the above? It is the correct answer. Next question. Species most commonly associated with periapical actinomyces is Actinomyces odontolyticus, Actinomyces israeli, Propionobacterium propionicum, or Actinomyces viscosus?
Actinomycosis or odontolyticus.
Correct answer is option B, Actinomyces israeli. Next question, BBD Cords. What does the acronym SIM stand for? Subscriber Identification Module, Service Identification Module, service integrated module, or subscriber internal module? The SIM card you use.
Service integrated module. C. Option C.
The correct answer is A, subscriber identification module. Now we move on to Bhojia Dental College, Baddi. Non-vital teeth, reversible pulpitis, primary symptomatic apical periodontitis, or phoenix abscess.
Option C, primary symptomatic apical periodontitis.
Yes, your answer is correct. Next question for Manav Rachna. Who is the Vice President of India? Mohammad Hamid Ansari, Mohammad Venkaiah Naidu, Pratibha Patil, or C. Rangarajan?
Mohammad Hamid Ansari A.
He was the last Vice President. Currently, Mr. M. Venkaiah Naidu is the Vice President of India. Now we move on to M.A. Rangoonwala, Pune. Which of the following pulp sensibility test is most appropriate for testing an immature permanent tooth? Electric pulp testing, testing with heated Gattaperka, test cavity, or cold testing? Your answer is correct. It is D, cold testing. Well done. Next question for Rangoonwala, Pune. All of the following are a modification based on Heatstrom files except HyFlex files, S files, Uni files, or light speed files.
D, light speed files.
Very well done, Pune. You're correct. Next question, Rangoonwala, Pune. The first period of elements in the periodic table consists of only hydrogen, hydrogen and oxygen, hydrogen and helium, or hydrogen and nitrogen.
Hydrogen and helium, C.
Very well done, Pune. You have told all the correct answers. Next, we move on to Ramakrishna Dental College, Coimbatore. Which of the following mimics an odontogenic pain originating in the maxillary posterior teeth? Cardiogenic jaw pain, sialolithiasis, temporal arteritis, or otitis media? The correct answer is temporal arteritis. The next question for Coimbatore. Which method of sterilization is least likely to dull and corrode carbide instruments? Glutaraldehyde, steam heat, dry heat, or ethylene oxide?
Option D, ethylene oxide.
The correct answer is dry heat. The next question for Coimbatore. Which city is also known as the Silicon Valley of India? Pune, Mumbai, Bangalore, or Hyderabad?
Option B, Mumbai.
Can you be louder?
Option B.
The answer is option C, Bangalore. The next set of questions is for Rama Dental College, Kanpur. Which of the following are true regarding coronal pre-enlargement except? It improves identifying the apical foramen, reduces the volume of irrigant in the canal, decreases post-treatment problems, or promotes removal of dentine mud?
A. Option A.
The correct answer is option B. Next question. Where is this used in our field? For tongue cleaning, for mixing cements, for detecting vertical fractures or cracks, or for mobility testing?
Option C.
Yes, it is the correct answer. It is the tooth sleuth. The third question for you. Where are the headquarters of NATO located? Belarus, Brussels, Birmingham, or Brooklyn?
Option B.
Yes, it is the correct answer. Next question for AMU, Team AMU. Ductility of a material is its measure of grain elongation, annealing, compressive strength, or castability.
Option A, grain elongation.
It is the correct answer. Which of the following is most likely to break in the canal? File, broach, reamers, or spreaders?
Option B, broach.
Very quick and confident correct answer. Next, for AMU, speed of rotation of Earth is highest at along the equator, at the North Pole, along the Tropic of Cancer, or along the Arctic Circle.
Option C, along the Tropic of Cancer.
The correct answer is along the equator. So we have finished with the offline teams, I suppose. Nobody is left. Now we will start with the online teams. Online teams, please respond as I call out your name. The first question will be from Army Dental College, R&R, New Delhi.
Yes, ma'am.
Army Dental, New Delhi. Okay. So the first question for you is, in which of the following conditions tooth presents with a selective sensitivity to percussion? Internal resorption, acute irreversible pulpitis, vertical fracture of teeth, or heavily restored teeth?
Ma'am, C, vertical fracture of teeth.
Can you repeat louder?
C, vertical fracture of teeth.
Okay, it is the correct answer, vertical fracture of teeth. We are not able to hear their voice properly. Now the next question for Army Dental. Which of the following will be least useful for pulp testing in a geriatric patient? Cold test, heat test, test cavity, or electric pulp test?
Option C, test cavity.
It is the correct answer. Option C, test cavity. Well done. The next question for R&R. Identify this logo. Universal Studios, Uncle Chips, Unilever, or Uber?
Ma'am, it's option C, Unilever.
It is the correct answer. It is option C, Unilever. Very well done, Army Dental. Next, we move to Goa Dental College and Hospital. Goa Dental.
Yes, ma'am.
Okay. So the question for you is, the setting of zinc oxide eugenol is accelerated in the presence of which of these? Calcium hydroxide, EDTA, chlorhexidine, or sodium hypochlorite?
It's B.
Repeat. Say it
Option
again.
B.
The correct answer is option A, calcium hydroxide. The next question for Goa Dental. Identify this instrument: Williams probe, DG16, Florida probe, or CPTN probe?
It's B, DG16.
It is the correct answer, DG16. Next question for Goa. By area, which is the smallest city in the world? Vatican City. It should be actually which is the smallest country in the world. Vatican City, Cyprus, Monaco, or Seychelles?
C, Vatican City.
Can you repeat it?
Option A, Vatican City.
It is the correct answer. Well done. Next question for Maulana Azad, New Delhi. Maulana Azad, New Delhi.
Yes, ma'am.
So the question for you is, Deciduous.
Ma'am, your voice is not audible. You're mute. Hello? Ma'am, B. Irregularly arranged. Ma'am, your voice is not audible. Ma'am, you're muted. It's muted.
But my voice is going through.
Yes, ma'am.
Now it is coming?
Yes,
Yes,
ma'am.
ma'am.
Yes,
Okay.
ma'am.
Next question. Endograms are radiographic evidence of quality of obturation, provide evidence of working length, provide visual evidence of circulation of irrigating solution in pulp space, provide microbiologic evidence of sterility of root canal.
Ma'am, D.
Pura bolo answer.
Provides microbiologic evidence of sterility of root canal.
The correct answer is option C. So your answer is not correct. The third question for you. What is the currency of Ukraine? Ruble, Hryvnia, Teng or Som?
Ma'am, A ruble.
A you are saying?
Yes, ma'am.
It is not correct. The correct answer is B, Hryvnia. The ruble is the currency of Russia. Now we move on to Kothiwal Dental College.
Yes, ma'am.
Yes, ma'am.
The first question, suitable burr for cutting access cavity through ceramic or porcelain is the round diamond, trans-metal burr, tapered fissure diamond, or the round carbide burr.
Round carbide burr.
Round carbide. D.
D. Ma'am, D.
D. Round carbide.
The correct answer is round diamond. Next question for Kothiwal. Which of the following teeth is an exception to the first law of symmetry in terms of the access cavity? Option A, mandibular first molar. Option B, mandibular premolar. Option C, maxillary molars. Or option D, maxillary premolars.
Mandibular premolar. B.
The correct answer is option C, maxillary molars. The third question for Kothiwal. Which is the hottest planet in the solar system? Mercury, Venus, Earth or Mars?
B. Venus,
आपको
ma'am.
तो अर्थ ही लग रहा है, हाँ?
B. Venus. B. Venus.
Okay. Yes, very well done. It is the correct answer, option B. So now we move on to Savita Dental College, Chennai. Savita, Chennai.
Yes, ma'am. Yes, ma'am.
The principle of ELARA for radiation safety stands for as low as radiographically achievable, as latent as radiographically achievable, as low as reasonably achievable, or as low as remarkably achievable. The principle of ELARA.
Option A, as low as radiographically achievable.
It is answer C, as low as reasonably achievable. Next question for Savita Dental College. C-reactive protein is an indicator of acute inflammation, BMI, kidney damage or liver damage.
Acute inflammation, A.
It is the correct answer. It is an indicator of acute inflammation. Third question, who is the founder of the video conferencing startup Zoom Technologies? Jeff Bezos, Eric Yuan, Michael Ping or Elon Musk?
Option A, Jeff, because.
The correct answer is Eric Yuan. Jeff Bezos is the Amazon person. So Next, now we move on to Panania, Hyderabad. Haptics in endodontics refers to tactile feedback during instrumentation, working length determination, irrigation of the canals, or obturation of the canals.
Option A, tactile feedback in instrumentation.
Can you be louder?
Option A, tactile feedback in instrumentation.
You're saying option A?
Yes.
Okay. Your answer is correct. It is option A. Next question for you. Which is the most common tooth to have an incomplete vertical root fracture? Maxillary central incisor, mandibular second molar, maxillary second premolar, or mandibular canine?
Ma'am, option C, maxillary second premolar.
Yes, your answer is correct. It is maxillary second premolar. The third question for you. She is the chairperson of the Infosys Foundation.
Ma'am, option C, Sudha.
Sorry? Repeat.
Option C, Sudha Murthy.
Yes, you are correct. She is Sudha Murthy.
Hello.
Very well done, Panania, Hyderabad. Now we move on to VS Dental College and Hospital, Bangalore. VS Dental.
No, yes, we hear you.
Okay. So the question for you, hyperbaric oxygen therapy is used for treating which of the following conditions? Removal of infected dentine, osteoradionecrosis of jaw, acute periapical abscess, or pulp polyp.
Option B, osteoradionecrosis of jaw.
Repeat. Remove your mask and tell the answer.
Option B, osteoradionecrosis of jaw.
Okay, it is correct answer. Next question. All of the following are examples of scaffold except intracanal blood, PRF, radicular dentine, and PRP.
Radicular dentine. Option C, radicular dentine.
Okay, it is the correct answer. Option C, radicular dentine. Next question for you. One question is missing, I think. VS Dental, I'll come back to you for the third question. Just wait, okay? Now I move on to the next team. Krishna Dev Rai, College of Dental Sciences. Krishna Dev Rai. Clinical presentation of a zygoma fracture is mobile maxilla, floor of the mouth hematoma, flattening of cheekbone, or paresthesia along inferior alveolar nerve. Krishna Dev Rai. They are not visible also, no? Krishna Dev Rai, Dental College. Should we move to the next team? So I'll ask this question from BHU. BHU.
Yes, ma'am. Yes, ma'am.
Clinical presentation of a zygoma fracture is mobile maxilla, floor of mouth hematoma, flattening of cheekbone prominence, or paresthesia along inferior alveolar nerve.
Option C, flattening of cheekbone prominence.
It is the correct answer. Next question from BHU. Ammonia in saliva causes increase in plaque formation, decrease in plaque formation, increase in calculus formation, or precipitation of salivary proteins.
Ma'am, option D, precipitation of salivary proteins.
The correct answer is decrease in plaque formation. Next question, BHU. Sanskrit is the official language of Uttar Pradesh, Uttarakhand, Madhya Pradesh, or Bihar. Your time is over. The correct answer is Uttarakhand. Now I move on to Sri Ganganagar, Rajasthan. During
Yes,
master cone
ma'am.
selection, if a cone
Huh,
fits
ma'am?
short of desired length, Ganganagar, please put your video on. During
Yes,
master cone
ma'am.
selection, if a cone fits short
It's
of
on.
desired length, all of these can be the reason for it except the master cone selected may be too large, too much of recapitulation, improper shaping of middle third of canal, or dentinal chips packed in the apical third. Your video is not on.
Option
We
B,
won't
ma'am.
accept your answer if your video is not on.
Ma'am, video is on, ma'am.
Your video is not on. Sri Ganganagar, Rajasthan.
देख
We'll move on the next team.
look देख reconnect no
Can you hear me?
हाँ मैम
Then
Ma'am,
please
the
put your
video is
video
on,
on
ma'am.
if you want to
एक
participate
मिनट
in the quiz.
what can you do ma'am actually the video is not
Next team. Okay. Now we are moving on to the next team, Manipal College of Dental Sciences, Mangalore. Manipal College?
Yes, ma'am.
Okay.
Hello. Yeah.
So your question is, during electric pulp testing of a maxillary incisor, probe should be applied to the incisal edge, probe should be applied to the cingulum, probe should be applied to the cervical third, or probe should be applied to the area of least neural density.
Ma'am, option A, probe should be applied to the incisal edge.
It is the correct answer. The next question from MCODS. Which of the following is not true regarding collimation of X-ray beam? Collimation reduces exposure level. It ensures restricting the X-ray beam to a size not more than 7 centimeter on patient's skin surface. The round collimators reduce exposure more than the rectangular collimators. The shorter cones provide more divergence of the beam.
Ma'am, option C, the round collimators reduce exposure more than the rectangular collimators.
The correct answer is option B. It ensures restricting the X-ray beam to a size not more than 7 centimeter. The next question for you, what does GIF stand for? Graphics Interchange Format, Graphic Image File, Graphic Interface File, or Gradient Interface File?
Ma'am, option B, graphic image file. Option B.
Option?
B, graphic image file.
The correct answer is A, Graphics Interchange Format. Next set of questions is for Saraswati Dental College, Lucknow.
Yes, ma'am.
Sir, end में पूछो। During history taking, a patient complains of pain. Which of the following characteristics of pain of complaint is least relevant? Pain complaint की least relevant. Character, site, severity, or tolerance?
Ma'am, D, tolerance.
D, tolerance is the correct answer. Next question for you. Which of the following is not a solvent used for removing guttapercha? Chloroform, ethylene chloride, rectified turpentine, or tetrachloroethylene?
C, rectified turpentine.
The correct answer is ethylene chloride. Next question for Saraswati Dental. Le Corbusier was the architect of which of the following cities? New Delhi, Chandigarh, Mumbai, or Jaipur?
Chandigarh. B, Chandigarh.
It is the correct answer. Next, we move on to Ramaiah University. Ramaiah University. Ramaiah University, can you hear me? So we will move on to the next team. ITS Muradnagar. ITS Muradnagar, can you hear me? ITS Muradnagar. So next team is Seema Dental College and Hospital, Rishikesh.
Yes, ma'am.
Okay. So next question is, how do aluminum compounds control bleeding? Precipitates proteins to physically obstruct hemorrhage, coagulates blood by classic mechanism, causes severe vasoconstriction of local vasculature, or involves rapid fibrillation of traumatized blood vessels. The alum compounds.
Ma'am, A precipitates protein to physically obstruct hemorrhage.
It is the correct answer, Seema Dental. Next question, what does the rotary instrument race stand for? Reamer with active cutting edges, reamer with alternating cutting edges, rotation with active elasticity, or reaming with elastic activity.
Ma'am, B, reamer with alternating cutting edges.
It is the correct answer. Third question for you. What is the symbol of Indian Railways? Tiger, horse, elephant, or lotus?
Ma'am, A tiger.
Sorry, repeat.
Ma'am, A tiger.
The correct answer is C, elephant. Now we move on to IDS Bareilly. IDS Bareilly.
Yes, ma'am. Yes, ma'am.
Okay. So the question is, radiographic examination shows a horizontal fracture of the apical third of the root. The best treatment should be root canal treatment, splint and re-evaluate the tooth for pulpal vitality at a time, apexification, or episectomy to remove the fractured apical section followed by root canal treatment.
Ma'am, it's option B. Splint and re-evaluate the tooth for pulpal vitality at a time.
Yes, it is the correct answer. Next question for you. Which of the following impression materials is most dimensionally stable? Reversible hydrochloride, irreversible hydrochloride, addition silicone, or polysulfide?
It's C. Additional silicone.
It is the correct answer. Next question for IDS Bareilly. Etymology is the study of insects, origin of words, languages, or spiders.
Ma'am, B. Option B. Origin of words.
Very well done. Your answer is correct, IDS Bareilly. Now we move on to AIMS New Delhi.
Yes, ma'am.
AIMS New Delhi.
Yes, ma'am.
Which of the following is designed to be used with light speed canal preparation? Simply fill, success fill, ultra fill, or compli fill?
C ultrafill.
Repeat.
C ultrafill.
The answer is A, simply fill. Name the procedure: core buildup, canal projection technique, pinlay, or endocrown?
Canal projection technique.
Speak with the
Canal
options.
Option B, canal projection.
Yes, your answer is correct. Canal projection technique. Third question for AIMS. Which country gifted Statue of Liberty to USA in 1886? France, Canada, Brazil, or England?
Or D, England.
Repeat the answer.
D, England.
The answer is France. Next question to Career Dental College, Lucknow. Career Dental College.
Yes, ma'am.
Furcation involvement is measured by CPITN probe, Williams probe, Neighbors probe, or periodontal explorer.
Neighbors probe. Ma'am, it's a C. Neighbors probe.
Your answer is correct. Well done. Next question from Career Dental. Etchant is preferred in gel form because it gives a better control over placement, enhances and concentrates the action of acid, helps visualization while placement, or forms a thick layer.
Ma'am, it's a better control over placement.
Very well done. Next question, Career Dental. Pick out the scalar quantity of the following: force, pressure, velocity, or acceleration.
Ma'am, it's B. Is pressure.
Very well done, Career Dental. All three correct.
My God.
Now I'll move on to VS Dental. One of your GK questions was left. VS Dental.
Yes, ma'am. Yes, ma'am.
Okay. Your question is, the purpose of choke in tube light is to decrease the current, to increase the current, to decrease the voltage momentarily, or to increase the voltage momentarily.
C. Option C. To decrease the voltage momentarily.
Please mask हटा के answer बताओ. I can't hear you.
Option C. To decrease the voltage momentarily.
The correct answer is D. It increases the voltage momentarily. Sri Ganganagar. So, Sri Ganganagar, I'll come back to you. Now, can you hear me? Sri Ganganagar.
Yes, ma'am. Yes, ma'am.
Okay, because
Ma'am.
after this, we are not going back to any other team now, okay? So, the question for Sri Ganganagar is, which of the following is used for analysis in a case control study? Relative risk, risk ratio, incidence, or odds ratio?
Ma'am, we can't hear you, ma'am. Can't hear you.
You can see the question and tell the answer. Tell the answer.
Which was following is the analysis in the case control study risk ratio. A, relative risk.
Answer is
Yeah, ma'am.
D, odds ratio. The next question for you, in treating a non-vital tooth with sinus, the sinus should be treated as follows: by doing the drainage of sinus, curettage of lesion, use of cautery to eliminate the sinus, or no special treatment for sinus.
D, ma'am.
Okay, your answer is
No
correct.
special
Option
treatment.
D, no special treatment. What happened?
Nothing, ma'am.
What does the word Sputnik, the name of India, Russia's first space traveler, mean? The moon, the first one, traveler, or lonely?
The first one.
The answer is traveler.
Okay, ma'am. Thank you.
Thank you for being so enthusiastic about the questions. So, with this, we come to the end of the first round. Our scorers will let you know the scores in a while. नहीं अब no अब हो गया. I think one or two colleges had some technical issues, but we can't wait long for them because we're already running very late. So you go on with the scoring. I'll come to you. So, I hope everybody enjoyed the first round. And I think people are enjoying the GK questions more than the endo questions. That is the real test actually. Endo to padhi rahe ho. है ना? Now we will eliminate few teams. I think how many teams from here? 6 teams. We will eliminate 6 teams from this round. और जो नीचे से ऊपर हम चलेंगे scores, जो नीचे के 6 होंगे, we'll remove them. Maybe उनमें भी tie हो, तो we'll have a question each from them as a tiebreaker. Okay? So Soumya will tell us soon about the scores.
The teams that have been eliminated are Seema Dental College, Savita Dental College, Rishiraj College of Bhopal. The teams that have tie are Kotiwal Dental College, VS Dental College, Shri Ganga Dental College, Subharti Dental College, Sardar Patel Dental College, Chandra Dental College, just these.
So it's a tiebreaker round. Only one question will be asked for 5, and the time given is 5 seconds. So the first team is Kotiwal Dental College. Kotiwal Dental College, are you there?
Don't make. Yes, ma'am.
Has to do. Kothiwal Dental College. The question
Yes,
for you
ma'am.
is, elective endodontic treatment is contraindicated in patients having myocardial infarction within the past 6 months. This is because of local anesthetic is absolutely contraindicated. There is an increased susceptibility to infection. There is an increased susceptibility of repeated infarction. Such patients should be treated in hospital under care of the physician.
C.
C, ma'am. C.
There is an
Yes,
increased
correct. Your
susceptibility of
answer C is
repeated
correct.
infarction.
Next team,
We are in.
Dental College, Bangalore.
Yes, ma'am.
The pro-taper cross-section is triple helix with U-shaped cross-section, triple helix with convex triangle cross-section, convex triangle cross-section with a wide radial land, convex triangle cross-section with a small radial land.
Option A, ma'am.
Time is
Option
over.
A.
A, ma'am.
Option A.
Time is over.
Option
A,
A.
ma'am.
Ma'am, we were
Ma'am,
telling A.
we were
Time is
talking.
over.
Ma'am, I think
Ma'am,
the voice was not
They are seeing
going.
the screen, sir. They are seeing the screen.
Ma'am, option A, ma'am.
Voice was not going through. Option A.
Your answer is?
A. A.
You are wrong. The answer is triple helix with convex triangle cross-section. Next team is?
Name in the WEF, World Economic Forum's Young Global Leaders list. Priyanka Chopra, Deepika Padukone, Vidya Balan, Nawazuddin Siddiqui.
Option A, Priyanka Chopra.
No, it's answer B, Deepika Padukone. The next team. The Army Dental Center. Army Dental.
Yes, sir.
Yes. Your first question is, what is the wavelength of frequency double ND-arc laser?
Sir, it's B10.
Nanometer, 1064 nanometer, 514 nanometer, 532 nanometer.
Sir, option B, 1064 nanometer.
No, it is wrong answer. The correct answer is 532 nanometer. The double frequency ND-arc laser is KTP laser. KTP. The second question is, what is the most common shape of the cross section of the root that develop vertical root fracture? Round, oval, conical, and flat.
Sir, it's B, oval.
Yes, it's the right answer. The third is GK questions. Who is the Health Minister of India? Dr. Harshvardhan, Dr. Mansukh Mandavia, Dr. Jiten Singh, and Sri Kaushal Kishore.
Sir, option B, Dr. Mansukh Mandavia.
Yes, it's the correct answer. Now the next team is Goa Dental College and Hospital.
Yes, sir.
Yes, your first question is, which of the following is not an example of carrier-based gatta parcha? Thermophil, microseal, dense fill, pro-taper obturator.
So it's D, pro-taper obturator.
Yeah?
Option D.
D.
Yes, sir.
Wrong answer is answer B, microseal. The second question, Melatonin is synthesized from which amino acid? Tryptophan, cysteine, glycine, and methionine.
It's A, tryptophan.
Yes, correct answer. Your GK questions. Who was the first Indian to win an Oscar? B.R. Rahman, A.R. Rahman, Bhanu Athaiya, Lata Mangeshkar.
It's Bhanu Atyaya. C, option C.
Yes, its correct answer is Bhanu Athaiya. So the next team is Maulana Azad Institute of Dental Science. Maulana Azad.
Yes, sir.
Your first question is C-shaped canal configuration was first reported in endodontics by Calvin and Cox, Sino and Cooks, Cooks and Cox, C. Boone and Sino.
Sir, C, Cooks and Cox.
Yes, Cooks and Cox. That is the right answer. Now the second question is, what is the minimum number of flutes in fencing bar? 10 flutes, 12, 8, 6.
8 flutes, sir.
Yeah, option?
C.
C is a wrong answer. I think it is B, 12 flutes. So the GS questions. Montreal global warming, food security, ozone layer depletion, sustainable development.
Sir, ozone layer depletion. Option C.
Yes, correct answer. So the next team is Kothiwal Dental College. The first question is, which among the following is a common interpretation error of the false negative response obtained from the electric pulp testing? Partial pulp necrosis, recently traumatized teeth, ineffective tooth isolation, contact with metal restoration.
B, recently traumatized tooth, sir.
Yeah?
B, sir. Sir?
Repeat the whole answer.
Sir, B, recently traumatized. Sir,
B, recently traumatized tooth.
Yes,
Yes, is the correct answer.
B, recently traumatized tooth.
Chlorhexidine significantly improved the resin bonding bond stability by virtue of which of the following properties? Collagen cross-linking and ion exchange, antioxidant property and metalloproteinase inhibition, and collagen cross-linking, ion exchange and antioxidant property.
Sir, it is C,
C,
metalloproteinase inhibition and collagen cross-linking.
Right answer. GS question. Which is the biggest high court in India? Chennai High Court, Bombay High Court, Calcutta High Court and Allahabad High Court.
Sir,
Allahabad High Court.
it's D, Allahabad.
Yes, it's correct answer. D, Allahabad High Court.
Yes.
Now the next team. इसमें नहीं है, ये भी तो है, पनीनिया, इसमें सीरियल में पनीनिया है, पनीनिया इंस्टीट्यूट ऑफ डेंटल साइंस, हैदराबाद.
Yes, sir. Yes, sir.
Your first question is, which of the following has the highest radiolucency? MTA, option B is biodentine, option C is zinc oxide eugenol, option D is metapex.
Sir, option D, Metapex.
Correct answer is option B, biodentine. which is not a GP solvent? Epinephrine, xylitol, limonene, and methyl chloride.
Sir, option D, methyl chloride.
No, the correct answer is xylitol. Confused with xylene. The next question is 1 TB is equal to 1000 GB, 1020 GB, 1024 GB, and 1028 GB.
Sir, option C, 1024 GB.
Yes, correct answer. Option C, 1024 GB.
Yes.
Now the next team is Saraswati Dental College, Lucknow.
Yes, sir.
यही है?
Yes, sir.
Okay. Your first question is, which of the following is contraindication for cast restoration? Partially subgingival restoration, restoration of endodontically treated tooth, cracked tooth, and developing young teeth.
D, sir. D. Developing young teeth.
Yes, correct answer. Now the second question is QLF, emit blue light. What is the reflection from carious tooth? Blue, green, red, violet.
B, green. B, green.
It is wrong answer. It is C, red. So the GK question is, line of cancer passes through how many states of India? 4, B8, C6, D10.
A, 4, 4.
Yes, loudly.
A, 4.
Wrong answer. It B8. Now the next team is IDS Bareilly.
Yes, sir.
IDS Bareilly.
Yes, sir.
Your first question is, the following pictures show which type of root canal configuration according to Baituki classification? Class 1, Class 3, Class 5, Class 6.
It's D, class 6.
Yes, it's correct answer. It's D, Class 6. Second question, which of the following root canal sealer contain nano silver particles? Endosequence BC sealer, AH plus, Guttaflow, MTA Filapex.
Option B, AH plus.
Wrong answer is option C, Guttaflow. Your third question, that is GK question, which of the following is the highest point in India? Mount Everest, Doda Beta, Kanchenjunga, George Everest.
Option C.
Wrong answer is the Kanchenjunga, is the highest point of the India.
Option C. Sir, we said C. Option C.
Huh?
Sir, we said option C. Said C. Yes, sir.
Okay. Right answer, right answer.
Thank you, sir.
Khatam?
The teams that have been eliminated are Saraswati Dental College, Lucknow, M.A. Rangoonwala, Sardar Dental Patel College, Bhojia Dental College, DAV Yamnanagar, and Rama Dental College. The teams that will be going in the next rounds are Maulana Azad, Army RNR, Kothiwar Dental College, IDS Bareilly, Paninia Dental College, GDC Goa, Career Dental College, and AMU. AMU, great going. You are only left outside.
मैम बताइए कौन सा
ये हमारा क्विज राउंड 4 शेयर तो नहीं करो ना अभी ठीक है ये है ना ये भी ऊपर वाले चारों हैं 4 ये 5
6 आइडियस बरेली 6 और
7
टोटल आज 3 बचे
So now we come to the fourth round and the first team is AMU. So are you ready AMU?
Yes ma'am.
So your question is enamel hatched by a tooth conditioner but not covered with a fissure sealant will demineralize within a month, remineralize within 3 months, absorb stain and discolor the tooth, leave the tooth more susceptible to caries attack.
Leave the tooth more susceptible to caries attack. Option D.
You're wrong. The answer is B. Remineralize within 3 months. The next question is the tuck back of the master gatta parcha cones refers to the tensile strength of the gatta parcha cone, the retention of the cone in the apical portion of the canal, the retention of the cone in the coronal half of the canal, or none of the above.
Option B. The retention of cone in the apical portion of the canal.
Correct. Now the GK question to you. Who was the first Indian woman president of the United Nations General Assembly? Vijay Lakshmi Pandit, Lata Devi, Indira Gandhi, Sarojini Devi.
Option A. Vijay Lakshmi Pandit.
You are correct. Now Now the next team is Army Dental College.
Yes,
College.
yes, ma'am.
Okay. The question for you is the format of all patients' records should follow universally accepted format. SOAP, PICO, OSHA or checklist?
Ma'am, answer is A, soap.
Yes, you are correct. Next question is PIPS stands for photon induced plasma streaming, photon induced photoacoustic streaming, plasma inverted photonic stimulation or photon inversion by plasma stimulation.
Ma'am, answer is B, photon-induced photoacoustic streaming.
Your option is?
B.
Answer B, photon-induced photoacoustic streaming.
Yes, you are correct. Answer is photon induced photoacoustic streaming. The GK question for you is how many dimples does an average gold ball have? 365, 336, 330 or 345?
Ma'am, it's B 336.
You are correct. The gold balls have 336 dimples. Next question is Goa Dental College and Hospital.
Yes, ma'am.
High volume evacuation provides all except which of the following? Decrease the amount of aerosol emanating from the patient's mouth, increase the patient's desire to rinse, decrease the patient desire to rinse, or increase visibility.
It's option B.
Yes, you are correct. Increases the patient desire to rinse. The next question is light curing is called autopolymerization, relies on ultraviolet light, it used to polymerize silver dental amalgam, is used to polymerize composite resin, restorative material and composite resin cement.
Ma'am, it's option D.
Let's see. Yes, answer is D, is used to polymerize composite resin restorative materials and composite resin cement. The GK question for you is, in motorcycling racing, what color is the flag they wave to indicate the winner? It's a red flag, a checkered flag, solid green flag, or the yellow flag?
Ma'am, it's option B, checkered flag.
Correct answer. The next team is Maulana Azad Institute of Dental Sciences, Delhi.
Yes, ma'am. Yes, ma'am.
When saliva touches the tooth surface, what takes place immediately? Demineralization, remineralization, activation, or nothing?
Nothing. Ma'am, D, nothing.
Your answer is?
D, nothing.
Nothing. So you're wrong. It's remineralization. Option B is the correct answer. Your next question is, when placing the sealant material, it is important to use the maximum amount of material to ensure full occlusal coverage. Use all of the material in the dispenser. Use the minimum amount of material to cover all the pits and fissure. Use air to move the material around.
Ma'am, C, use the minimum amount of material to cover all the pits and fissures.
Yes, you are correct. The GK question for you is, the National School of Drama is situated in which city?
From New Delhi. New Delhi.
Pune, Mumbai or Bangalore?
From New Delhi.
मेरा कॉलेज है।
Yes, you are correct. Now the next question is Kothiwal Dental College.
Yes, ma'am.
A posterior tooth with a deep preparation may require a base that is designed to prepare pulpal defense by functioning as a insulating base, protective base, spinal restoration, or sedative base.
Protective base.
B. Protective base.
You are wrong. It is insulating base, option A. The next question is a caries risk assessment test is used to determine the salinity of the saliva, determine the amount of fermentable carbohydrate present in the saliva, determine the number of mutant streptococci and lactobacilli count present in the saliva, or to determine the level of salivary immunity.
B. Determine the amount of fermentable carbohydrate present in the saliva.
Your answer is B.
Yes, ma'am. B.
This answer C. Determine the number of mutant streptococci and lactobacilli count present in the saliva. The next question, the GK question for you is, the movie Fitur is an adaptation of which prominent literary work? Great Expectations, Hamlet, Pride and Prejudice, or Macbeth?
Ma'am, it's B. Hamlet.
Wrong. It is Great Expectations, option A. The next team is Panania Institute of Dental Sciences.
Yes, ma'am.
Panania.
Yes, ma'am.
Which surgical procedure described hemisection? Removal of the apical portion of the tooth, surgical separation of multi-rooted tooth through the furcation area, removal of one or more roots of a multi-rooted tooth without removing the crown, or removal of the diseased tissue through scraping with a curette.
Ma'am, option B, surgical separation of multi-rooted tooth through the suffocation area.
Option let's see what the answer is. Yes, you are correct. It is answer B, surgical separation of multi-rooted tooth through the furcation area. The next question is, which of the following could not be suggested as an intervention for the prevention of dental caries? Chewing mints, antibacterial therapy, decreased ingestion of carbohydrate, or fluoride?
Ma'am, option A, chewing mints.
Yes, you are correct. The GK question for you. The iconic sentence, Pushpa, I hate tears, was featured in which movie by Rajesh Khanna? Is Aradhana, Amar Prem, Kati Patang, or Anand?
Ma'am, option B, Amar Prem.
Yes, you are correct. The next team is Institute of Dental Sciences, Bareilly. Bareilly?
Yes, ma'am.
Fluorescence of tissue stimulated by laser light is mostly important in caries diagnosis, biostimulation, periodontal therapies, or both A and B.
Ma'am, is option D, A and B.
No, you are wrong. It's caries diagnosis. The next question is, the purpose and use of panoramic image include all of the following except one. Which one is the exception? To evaluate the impacted teeth, to evaluate growth and development, to evaluate and diagnose caries to examine the extent of large lesion.
Ma'am, option B, to evaluate growth and development.
It's answer C, to evaluate and diagnose caries. So you are wrong. The GK question comes to you. Who was offered and turned down the part of Han Solo in the original Star Wars film? Sylvester Stallone, A.I. Pacino, Bruce Willis, or Roger Moore?
Ma'am, option D.
Yes. It's option
D. D. Four.
Yes, you are correct. It's Al Pacino. Your D. Huh?
D.
The correct answer is Al Pacino.
B ना मुझे B नहीं she's not saying D ना हाँ B ही तो बोला
The last name is Carrier Dental College.
I don't know they was not saying
Carrier Dental College.
Yes, ma'am.
Root canal treatment is contraindicated in vertical fracture of the root, diabetic patient, unrestored teeth, or periodontally involved teeth.
Ma'am, it's a vertical fracture of root.
It's correct. Answer is correct. Vertical fracture of the root is correct answer. The next question is, exposure of glycinomer cement to topical fluoride application has no effect on fluoride release of glycinomer. It increases the fluoride release of conventional rather than resin-modified glycinomer, which charges glycinomer with fluoride, or it is not influenced by permeability of the glycinomer.
It's ma'am, B increases the fluoride release of conventional rather than resin modified glass ionomer.
No, it is wrong answer. The correct answer is
Ma'am,
which
it's
charges
B.
glass ionomer with fluoride. So the GK question for you. From which movie this quote is taken? A friend should always underestimate your virtues, an enemy overestimate your faults. The Godfather, Game of Thrones, Friends, or Cruella?
Ma'am, it's D, Cruella. Ma'am, D, it's D, Cruella.
So no, you are wrong. It's The Godfather.
Hello?
The correct answer is The Godfather.
Only one is correct.
We come to the end of this fourth round. So again, there is a tie between AMU and Maulana Azad. So the first question goes to AMU. Which of the following material has been shown to stimulate reparative dentine formation most effectively when applied to the pulpal wall of very deep cavity? Copperlite varnish, calcium hydroxide preparation, zinc phosphate cement, or anhydrous glass ionomer cement? 5 seconds.
Option B, calcium hydroxide preparation.
Yes, you're right. Calcium hydroxide preparation is the right answer. The next question goes to Maulana Azad.
Yes, ma'am.
Maulana Azad, ready?
Yes, ma'am.
You have only 5 seconds to answer.
Yes, ma'am.
Patient complains from pain during mastication which had gold onlays. The pain could be due to chemical from cements, high thermal conductivity of gold related to periodontal ligament or cracked or fractured surfaces.
Ma'am, answer is B, due to high thermal conductivity of gold.
Wrong, it is related to the periodontal ligament. ये फिर हैंग हो गया फरहान हैंग हो रहा है मैंने निकाल लिया हैंग हो रहा है
The teams that have been eliminated at the end of round 4 are Maulana Azad, Kotiwal Dental College, IDS Bareilly, and Career Dental College. The top 4 teams that are still in the running are Army RNR, Paninia Dental College, GDC Goa, and AMU.
देर से चल भी रहा है So now we have come to the final round of this quiz competition. 4 finalist team which are there, Soumya has already announced. So the first 3 teams, the first leading scoring teams of this round will be considered the winner and the first and second runner-ups. And if the scores are tied, then we'll have a tiebreaker round for them. दूसरा लगा दी क्या करें नहीं तुम अपना ही दे दो तुम्हारे में तो आईपी एडेड है ना In this round, we will have 3 subject questions and 1 GK questions each. 3 subject questions and 1 GK questions from each team. 4 questions each. And the scores will not be carried on in this round. Only the scores of this round will be considered. The four teams are AMU, Army RNR, Panania Hyderabad, and Goa Dental College. So, is everyone ready for the final round? The first question is from AMU, the only offline team we can see here. So, the first question AMU for you is, photobiomodulation refers to swift tissue lasers, soft tissue lasers, surgical lasers, or soft lasers.
B. Soft tissue lasers.
It is the wrong answer. It is the soft lasers. These are the non-thermal soft lasers. The second subject question for you is, which of the following is not correct regarding root canal irrigants? Chlorhexidine reacts with sodium hypochlorite to form an orange color precipitate. HEBP does not react with hypochlorite and can be used with it. Hypochlorite is used as final rinse in most irrigation protocols. Iodine potassium may cause allergy in some patients.
Option C. Sodium hypochlorite is used as final rinse in most irrigation protocols.
You're correct. It is the right answer. The third subject question for you is, identify the procedure. Infiltration anesthesia, intraosseous injection, trephination, or incision and drainage.
Option B. Intraosseous injection.
It is the correct answer. Scorers, please note. Next team is? The next team is Army Dental RNR New Delhi.
Yes, ma'am.
I'm sorry, the GK question is left. For AMU, the GK question is, what was the name of the cargo ship that got stuck in the Suez Canal in March 2021? Ever Given, Ever Green, Ever Ready, or Ever Ship?
Option B. Evergreen.
No. It is Ever Given. Option A. So the next set of questions is for Army Dental RNR, New Delhi.
Yes, ma'am.
Heat test should not be applied for more than 5 seconds as it may activate A delta fibers and cause lingering pain. It may activate C fibers and cause a lingering pain. It does not give any result after 5 seconds or the treatment time is prolonged.
Ma'am, option B, it may activate C fibers and cause a lingering pain.
Your answer is correct.
Second question for you is, in high-risk caries patients, biannual oral checkups are recommended, bite-wing radiographs every 3 months, annual oral checkups are recommended, or bite-wing radiograph every 6 months.
Option B, ma'am, bite wing radiographs every 3 months.
It is wrong. The answer is option D, bite-wing radiographs after every 6 months. The third subject question for you is, which of the following is used in management of the condition shown in the picture? 90% trichloroacetic acid, 5.25% sodium hypochlorite, 17% EDTA, or 2% citric acid?
Ma'am, answer is A, 90% trichloroacetic acid.
Yes, it is correct. It is internal resorption defect. The GK question for you is, who became the first private citizen to reach space aboard his own rocket ship in July 2021? Jeff Bezos, Richard Branson, Mark Zuckerberg, or Warren Buffett?
Ma'am, B, Richard Branson.
It is the correct answer. It is Richard Branson. Next team. Paninia, Hyderabad.
Yes, ma'am.
Paninia, Hyderabad. Microabrasion technique is suitable for age-related staining, is suitable for tetracycline staining. In the modified form, hydrochloric acid is replaced by sodium hydroxide. Hydrochloric acid dissolves enamel slower than sodium hydroxide.
Option B, it is suitable for tetracycline staining.
The correct answer is option D. In the modified form, hydrochloric acid is replaced by sodium hydroxide. The next subject question for you. Which of the following is an example of mechanical allodynia? Pulp hyperemia, microabscess, hot tooth, or cracked tooth?
Ma'am, option B, microabscess.
The correct answer is hot tooth. The next question, identify the morphological variation shown in the picture. Fusion, dense in dente, gemination, or dense invaginatus?
Ma'am, option D, dense invaginatus.
Option D, you are saying?
Yes, ma'am.
D. The answer is option C, gemination. The GK question for you. Omicron is the 8th letter of Greek alphabet, 10th letter of Greek alphabet, 13th letter of the Greek alphabet, or the 15th letter of the Greek alphabet?
Ma'am, 13th letter of Greek alphabet. Option C.
The answer is D, 15th letter of Greek alphabet.
Next.
Now the next set of questions is from GDC Goa. GDC Goa, you are ready?
Yes, ma'am, we are ready.
While performing endodontic treatment on a hemophilia A patient, intraligamentary anesthesia should be avoided. Factor VIII level should be raised to 30 to 50% before giving intraligamentary anesthesia. Long-acting anesthetics should be used, or endodontic therapy is contraindicated in these patients.
Ma'am, it's option B, factor 8 level should be raised to 30 to 50%.
Option B.
Yes, ma'am, option B.
The correct answer is option C. Long-acting local anesthetics should be used. The next question for you. Minimum thickness of MTA or calcium silicate cements needed over an exposure site, pulpal exposure site, is 1.5 mm, 2 mm, 3 mm, or 5 mm?
Ma'am, it's option B, 2 mm.
The answer is 1.5 mm. Option A. The next question for you. Identify the instrument shown in the picture and its function. Micro needle holder, Macaron's kit for silver cone removal, Gutta perca plier for obturation, or a Stieglitz plier for removing silver cone?
Ma'am, it's option D, Stegless player for removing silver crown.
Silver. This is the correct answer, option D. So, the GK question is left. Who holds the world record for summiting 14 peaks in shortest time? Nirmal Nimsai Pujra, Sherpa Tenzing Norgay, Edmund Hillary, or Bachendri Pal?
Ma'am, it's option C, Edmund Hillary.
The correct answer is A, Nirmal Pujra, who completed this in 6 months on 24th of May 2019. So, do we have the scores final now? Who are the top leading score के साथ बताओ? Highest score? Army RNR is leading with a score of 30. AMU second with 20. And GDC Goa is third with 10 points. So these are the winners for today. First is Army RNR, second is AMU, and third is GDC Goa. So much congratulations to all the winners.
So our congratulations to the winners of the All India Quiz Contest. It was a very strongly contested, very competitive event, and the prizes and the certificates will be sent online. The trophy, we have only one team of AMU is here on site, so they are the first runners up, and the Army are the winners, and Goa is the second runner up. So our congratulations to all of you, and a big round of applause to all the contestants and all the participants. And it was a lovely time we had interacting with all the 31 teams from all over the country. We have with us the president of the Indian Endodontics Society here with us, Dr. Vivek Hegde, and also the former president of the founder president of the Indian Endodontics Society, Dr. Anil Kohli. Both would like to interact with you all, and they were all here all throughout your program and seeing the program. Please, Dr. Kohli.
Thank you, Asim. It was a wonderful experience to sit down that long and really enjoyed. Even you made a couple of mistakes in answering with me, but we gave them one wrong answer, still they made it. Heartiest congratulations to AMU and to the winning teams of RR Center, Army Dental Center, and the third one is Goa, IDA. Right. So we wish you good luck and we look forward having more such competition. It is not only fun, but it's a lot of knowledge also. So which is the best part of this whole program. And to all the ladies who have organized this program, you also. So it's a really great.
No, I can tell you this, that this was highly confidential, the question making. Only 3 faculty members were involved in the question making, and that is Dr. Pramila, Dr. Rakesh Yadav, and Dr. Ridhim. Nobody else was involved in the MCQ preparation and was very confidential. And as you know, as host teams, we do not participate in this event. And we would like to see you all next time also, and maybe in larger numbers. And we would also like to invite the SAARC countries for your information from next time. The students from Bhutan and Nepal and Bangladesh and Maldives and other countries. Thank you everybody for being here, and I request Dr. Vivek Hegde to speak a few words.
Like they say, all is well that ends well. So is this program. I think it's only getting bigger and better. From last year, what I'm seeing this year, more number of teams, more enthusiasm and participation, including the organizing team that did it even well. Thank you so much for inviting us, and I'm sure next year will be even better. Best wishes to the winning team and all the participating team. It's well done, and God bless. Thank you.
Thank you. A big round of applause to all our residents also, the GR1s, GR2s and the GR3s. I cannot name them all, there are 20 of them. But they have all contributed very sincerely, and they have worked very hard and very selflessly. So my congratulations to the entire team, entire department of Cons and Endo, at the King George's Medical University, and we hope to do it again, make it a traditional and an annual event, and hope to have it every year. Thank you, everybody, for joining. And 1 minute, we have the on-site team, the first runners-up, the AMU Aligarh, and I will request our guest of honor, Dr. Kohli, and with Dr. Vivek Hegde to come and give away the prize. So I'll announce. So the winner team are Dr. Lavanya and Dr. Sharmila from Aligarh Muslim University, College of Dental Sciences. The prizes for the Army Dental College will be sent. We will send it with Dr. Kohli today, and I'll pass it on to Dr. Sonali, Colonel Sonali. And for the Goa team, we will send it through Dr. Vivek Hegde, because he is going via Bombay, and he will deliver it to Dr. Aida and the students in Goa. Thank you to everybody for joining us.